Well, welcome back to the Trust Your Gut podcast. I'm Erin Trent Johnson, transformational leadership coach, storyteller, mama. And I'm here with Antonio Aragona, doctor of Ayurveda. I call him Dr. A, and he is my Ayurvedic doctor. And we are excited to bring you the February edition of Trust Your Gut. How are you doing, Dr. A?
I'm doing great. Just going day by day as the season is progressing, and we're leaving February behind in the next couple of days, and March is around the corner, and what that means for all the, living beings going through seasonal changes.
Yes, yes. We have had our healthy dose of snow, our second, I think, big polar vortex drop of the season just a couple days ago. So envisioning sprouts and a new life in the seasonal change is a little hard right now because behind me is a wall of white snow and I'm on the second floor of my house. So I would love to hear from you how you are seeing this change of seasons coming.
Yeah, I mean, this is, as we've transitioned mostly into like the kapha time of year, which is like predominant with the qualities of like cold, heavy, and moist. And those are the general
Mhm.
qualities of kapha, leaving vata season behind, which is usually cold, dry, and light. And so, yeah, the seasonal transition is, occurring. And then, we notice the difference between a month ago when we had the snow and it froze. That freezing quality is vata. It's not kapha. Kapha is cold, wet, and heavy. So the drying aspect, the dry cold creates ice, right? Ice is briefly, very dry. And when you grab an ice cube, it sticks to your finger for a second because it's wanting the moisture from your finger. But it indicates that it was dry for a split second. And so the snow lasted a long time because there was so much vata quality in the atmosphere. And Kapha now is, being influenced by a little bit more heat in the atmosphere. And as we progress each day and we have the daylight savings again coming to change the time, more sunlight. More sunlight means Kapha won't be as cold because more warmth is entering through the sky from the sun's, projection onto us. So the snow is already melting quicker than it did last time. It was already frozen at this point and lasted for weeks, for about a month.
Yes,
And now it's like half of what it was yesterday, just within 24 hours of when it stopped snowing. So these are the things that we watch.
yes.
In Ayurveda, we're always looking at the seasons. We're always looking at the qualities of the day, where they're called the gunas. And it's like the gunas are the qualities that we're trying to understand in the moment to moment. And this is how operative Ayurveda is. The functionality of a lot of Ayurveda depends on understanding qualities of things and the
Mhm.
subtle to overt. And so, and one of the key factors that influences like how we experience, optimal versus less than optimal quality of the day is what, we call in Ayurveda charya. And, charya is classically referred to a term that's indicating like regimen or, routine or, like schedule, you know. Um, and so understanding of what is schedule. And, to some degree, everyone has a schedule, people wake up, people eventually poop, people eventually eat, people eventually maybe, walk or exercise or go to the gym or, et cetera, et cetera. And then people eventually go to sleep. But that is not, the schedule that is meant by, this aspect of charya, which is dinacharya, which is like the daily practice. And so the daily regimen, what do we do in each day? And Ayurveda says, there are general practices that we do every day that should be a thing we do every day. And then there's modification because, if you think dinacharya is for every day, seasonal daily regimen, we have seasonal regimen, which is like Ritucharya, which is knowing like seasonal transitions, we have to adjust to that accordingly. So it's a clock within the clock, basically. And then, the other charya we have is Ratri Charya, which is like the sleep routine. you know. So it's interesting that it has its own category, Ratri Charya, amongst or betwixt or within Dinacharya, because it is a practice within the day cycle. And then, of course, you know, we'll say like as a Venn diagram, it also overlaps with season because sleep will adjust according to the season. When it's summer, how does the sleep affect us? What time do we go to bed versus the deep winter time when it's darker out? Like we're understanding like these pieces, these three overlapping concentric circles of the charya and knowing how to, apply it. It's foundation to the medicine. A person coming in with poor sleep, poor eating habits, poor exercise habits, but they have conditions which will happen. It's a thousand times a fact. Any person that's
Hmm.
not living in the context of a certain cycle, certain rhythm, Western medicine says the circadian rhythm. Yeah, Ayurveda is more in depth than just understand what the circadian rhythm is. It's like one small piece of understanding the whole picture of the person, but it's a useful piece. It's a compass, right? And so we have to understand, schedule doesn't just mean like, well, whenever I do whatever, I still get to do these things. This is not correct. The body is, as a quote from one of my teachers back in the day, the body is um, a historical system that requires consistency for health. It's the
Hmm.
consistency piece. The consistency piece, in many ways, often will bind us to the daily regimen because we need a consistency. Otherwise, this erraticness is by default Vata. Vata is unpredictable. Vata's always on the go. Vata's mobile. It's erratic. It's just, it's the wind that starts to pick up the current and it doesn't have a pattern, you know, and it picks up and then leaves devastation when it's in acceleration. You can have a gentle breeze that blows the leaf off the tree, but and Vata really picks up. We have a hurricane, we have tornadoes, you
Hmm.
know. The power of Vata is the most powerful of all the doshas because it is what creates movement for all the other doshas. It is movement by design. Anything that moves
Yes.
is Vata. To get up in the morning, we need that element of Vata in the physiology, in the mind, the rajasic quality, the subtle qualities of the gunas, to get up and go from bed to brush your teeth. Like we need that movement. But when a person's like, I always have to do something. I'm always traveling. I'm always on the go. I'm always doing this. I'm in this event. I'm doing that work retreat. I'm doing this, you know, thing and that thing and then this thing and the thing, and I'm just living life. Yeah, you're gonna have aches and pains and joint issues and skin issues and sleep issues and digestive issues. Of course, this is cause and effect. This is karna karya in Ayurveda. And when we understand, well, I have to live my life. Yeah, then you'll just live less. You'll live less with quality. Like again, what is the quality of the life?
I want to pause you for a second because I'm really thinking about this pattern of I'm always busy, I'm always overscheduled. I don't have control over my schedule, right? This is a pattern that I have known in my body, in my historical record, for many years, and I think one of the things that I have become mm, very soft and tender with myself, but also aware of my Vata experience, and the way in which it has felt like, oh, this must be beyond me. I am not in control. I am not able to um, discern what I can say yes and what I can say no to. So there's this, I think this question that's emerging for me as I understand Vata, right? And especially the Vata of my mind. Um, my racing mind or my thoughts that go from one thing to the next and build thought webs, which my brain is very skilled at doing. And also the way in which I cannot see time bound. And so, right, part of the way that my brain works or my executive function is that I actually have to have external supports around binding time.
Hmm.
Um, and so, I think I'm curious here about the ways in which um, we can relate to this movement that is conscious and maybe about support and not control. Does that make sense?
It does. And it's common when people have an excess of vata in the mind, which is usually considered rajasic qualities, which can coexist and be parallel to vata accelerating in a person's physiology, which is when we talk about doshas, we're talking about vata, pitta, and kapha, but the doshas of the mind or, sattva, rajas, and tamas. And, sattva isn't necessarily, uh, um, you know, pathological, but nonetheless, there's a subtlety. And so understanding like when we're dissecting, well, what is moving, who is moving, and how much movement is. And, the tricky part, but the cool part is that the body will never lie, right? When it's producing
Mhm.
symptoms, it's in discordance with the lifestyle and the diet. In Ayurveda, ahar vihar. It always says that all diseases are managed prolonged or prevented through ahar vihar, diet and lifestyle. Diet and lifestyle fall within, dinacharya, ratricharya, ritucharya. And so it's understanding, in the context of like what are these things that we're doing as we're aligned with nature. And so if we're noticing through the barometer of the body producing symptoms, there has to be some sense of reflection on that, you know.
Mhm.
And if you're so on the go and you're so go-go, then you won't. You'll keep pushing past, but the interesting thing about life, it's reluctant. When it wants you to understand something, when you're not aligned with it, the message will get louder.
Oh,
The,
yes.
the, the disease will get louder. So when we're questioning, like, well, how do I do this and the other thing? Because Vata, in essence, doesn't want to be controlled. But when it has a structure, it's harnessing, we have the chaotic winds that go throughout the entire region of our country and other countries and over the oceans. We
Mhm.
harness the wind power to the windmills to create electricity, which creates life and all these things. We're harnessing the power of Vata in a structured way, these windmills, right? We see this. They're
Yes.
very beautiful. They're white with the little, fanning blades. And it's like we're harnessing the power of this creativity, this movement to do something. Because without that structure, it will just become the tornado that just because tornadoes have no structure. There's no rhyme or reason. Meteorologists and tornado chasers, they have a general sense of like predicting because now they're really not just scientifically like through years of demonstrative data and analysis and stuff like that. They can hone in more respectfully what's happening with the currents and looking at the sky patterns and the clouds. When it does this, it creates this kind of tornado. You know, like that's all great. But they will all say, if they really are in tune, the ones that really are good are that they're in tune with nature and they're
Hmm.
understanding, whether it's that hunch. And, when we get this hunch, and it's a point from clarity because it's remiss when our minds are running all over the place, but we don't miss it when that fraction of a second in that stillness, just before a tornado is about to start there's a pause that happens in the environment.
Mm.
That's the electrical current, the electrical field changes, and your nervous system, because we are part of nature, is aligned with that. So there's like, oh, it's about to create, whatever it is. We can feel these kind of things, and we have to allot the time to do so, which requires slowing down, which, meditative practices and art practices that allow us to like disconnect from the turbulence so that we can get clear so that we know. And then that's how we're harnessing this energy through that place. And so it's no longer like, oh, I feel controlled and limited in my capacity. Now it's like I'm learning how to work within the context of it to cultivate it in a more potent way, and just
Hmm.
to kind of like back up and just kind of give a shloka, of course, as there
Yes.
are
Thank
three
you.
main texts in Ayurveda, which is the Charaka Samhita, Shushruta Samhita, and Ashtanga Hridayam last. The three primary, the three lesser are called the Laguptrayi, they're still like major. Like there are six major texts, but the three major and the three minor, but these are still the primary text. Baba Prakash is one of the texts, and it spends a lot of time discussing, like the different aspects of dinacharya. And so here's a shloka. Um, Manavo yena vidhina swasta asti stati sarvada tameva karya edavadyo yataha swastyam sade shitam dinacharyam nishacharyam ritucharyam yatoditam acharam purushaha swastaha sadha tishtati nanyata. So the methods and regimens for people to maintain their health consistently and regularly must be properly instructed by the Vaidya, the Ayurvedic physician,
Hmm.
so that health can be preserved. These methods are explained here in this science and include daily practices, nightly practices, seasonal practices. Adhering to these behaviors and routines allows people to always maintain their health. So it's right there in Ayurveda that we say, to maintain the properness of health, these things must be understood. These things must be, uh, you know, um, aligned with, because the deviation from it. Now, contemporary living in and of itself is a hetu, or ideological factor for disease. Contemporary living is
Hmm.
is as of 2026, and as it continues to move forward, is an ideological factor of disease. People are just so busy. One of the terms we've mentioned before in Ayurveda with other podcasts is ati chestataihi, which is like multitasking, always busy. This person that is always
Yes.
busy is always on the go. This is one of the precursors in Vadavyadi, which is like one of the main categories and has its own chapter, very extensive chapter, on the 80 main diseases of Vata. Ati Chestatai, multitasking on the go, always go, 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 go. And so the body will never lie because it will produce symptoms. When you're lying
Hmm.
down and can't get up, it's produced a symptom. And because of that, it's going to be indicative that something has gone awry from ahar, vihar, dinacharya, raticharya, ritucharya. Of course, these are all the things, but we take for granted these kind of things because we're not taught these kind of things, you know. And it's like I
Hmm.
remember in elementary school, it was sixth grade when they were talking about dental hygiene and things like that. They would give us like these like little packets that were like, and we had a piece of paper, we had to document when we brushed our teeth. And then we had to put this little, um, it was like a tablet, this pink tablet that you put in your mouth that would,
Oh, the fluoride.
I don't know, it wasn't
No?
fluoride. It was to indicate where you didn't brush.
Oh, okay. That's kind of
So
like a what is it? Like the black light? Like, well, I'm thinking
it
about
was
when they use
kind
the
of, I
black
didn't need the
light
black light
and
to do it, which I'm like, what were they
gels.
giving us to do this? But that's a whole different thing.
I
But
know, like
nonetheless,
what?
and I remember distinctly like this thing, and I would smile and I remember like, oh, I missed this one. And it's like, but it was encouraging, like brushing your teeth twice a day, or
Yes.
maybe three times a day, morning and then evening for sure. You know, brushing your teeth before you um eat anything, before you put anything in your mouth. You brush your teeth first thing in the morning. And that was encouraged back in that era. And now it's like people
Hmm.
just brush their teeth whenever, which, often the mouth bacteria that isn't cleansed and fortified, we swallow and goes in the digestive system. Where do you think it goes?
Hmm.
And then you're
Hmm.
adding to it, like you're eating and swallowing it. Yeah, and I'm just using this as an example of dinnercharya. Like you wake up, you brush your teeth. You wake up, you poop. You wake up, you have some hot water if it's relative to you. You wake up, you shower. You should bathe pretty much every day in Ayurveda, it says. And it
Hmm.
should be pretty much every day at this particular time. So there's that consistency piece. And then you have breakfast, you have lunch, you have dinner, you have exercise between these particular times of days. Sleep should be by 10 o'clock, like asleep should be not in bed at 10, asleep by 10. Like it says that, you know, I give a little forgiveness and say by 11, the latest. But those also is overlapping with the different times of day that doshas are governing and why certain things are optimized. You know, Western medicine found more often that 10 o'clock is when melatonin really starts. Well, melatonin starts to slowly secrete in the physiology per Western medicine after 2 p.m., afternoon, but it actually gets more
Hmm.
at a peak around 10 p.m. So people that are, staying up to 11, 12, 1, 2, you've missed that window because you've exhausted and depleted the melatonin that was required for you to fall asleep.
Hmm.
And I'm speaking relative to like the average person that does have a 9 to 5 kind of job or schedule. The people that don't have a proper schedule, that they're nighttime workers. We need surgeons, we need EMS workers, we need firemen, we need policemen to answer that call at 2 o'clock in the morning. They will always have a sacrifice. They are sacrificing their health in the name of duty, you know, and dharma, right? And so if this is their
Hmm.
dharma, then it's understood in the context of that person's life that they're going to accrue something in the background towards ill health. It's just by design. It has to be accepted. 100% health
I'm
cannot,
curious.
yes.
This is just bringing up another question for me because this, when we talk about duty, right? And I'm thinking about, from my perspective, as a coach who works with movement leaders, who works with people committed to social justice and who are actively committing their lives, right? Their work and what for many folks ends up being the more of their life outside of what is considered work, right? And so for the folks, and I think especially for people who are often handling uncompensated emotional labor for themselves, for their families, for their communities, their work is taking them, or their time is often dedicated, and their labor is often dedicated to a communal interest that lives
Hmm.
beyond the 9 to 5,
Hmm.
that has them at community meetings and town halls and in people's homes and
Hmm.
uh you know at any hour. And right now I'm thinking about folks who are providing sanctuary and support
Hmm.
for people in their community at any and all hours of the day. So how do we figure this in to a vision of moving with these natural rhythms and what Ayurveda says about our schedules?
Yeah. In that case, it's like we understand that if this is their, so it's like the ideal is what I mentioned before. If it's not the ideal, and then we work within the context of what is real, what this person can do, then to have some routine still that's consistent with the daily practice of that person is essential. So that person might not have, maybe their breakfast starts at 8 p.m., getting ready to go into the hospital or, whatever facility, or and then they have their, their lunch at like midnight or 1 o'clock. And then they have their dinner at, when they're finishing their shift at like, 4 or 5 in the morning. And then they go to sleep, and then um, there are some things that we do in Ayurveda as far as sleep for those kind of people, you know, and so then they're aligned with that schedule, even though it's flipped. But at least it's still a consistent schedule, and we try to implement, and then we put some herbs, but also to know if this is what's real, there's going to be something that's going to come. It just has to be understood. It's just what the life is. And so that's the Dharma, that's the soul um, purpose that this person is meant to do this role in this life. And part of it is also the disease that comes with it. Sometimes the disease is part of the lesson of the life unfolding. It's not, you know,
Hmm.
it's the lesson. It's never considered a punishment. It's a lesson.
Hmm.
And in
Oh,
essence, I would say maybe
yes.
like maybe all the diseases people get are just lessons for awareness rather than condemnation and punishment, even though it can feel that way from the place and experience of that person's perception of it, that they must have done something wrong and now they're suffering. It just might be just a lesson that's meant to bring you to the next level to figure out um, more of your consciousness and where you're at within your individual soul.
I know this very well. I mean, we just talked about this with my own health and my experience going into Panchakarma, and I think we really spoke to, and I can say for me, the last year, gosh, the last year and a half, I have been learning a lesson, and the kind of lesson where I have felt so debilitated
Hmm.
that it did feel like punishment.
Hmm.
What have I done to get here? But I have done so well. Those are the stories, the narratives that I could play in my mind. And so I'm conscious of how that shift or the elevation in my own consciousness, my
Yeah.
own awareness that, oh, this is a lesson. When we started talking about the historical record of my body, and you very clearly shared with me, there are patterns that have been in place with your
Hmm.
sleep. There are patterns that have been in place in your historical context, in your systemic context,
Hmm.
that are needing to be worked out, needing to be excavated at that level. And
Yep.
so that that really brought me to, I think, a place of elevated consciousness in my life where I could lift up and not like detach from my actual experience, but lift up and have a different perspective. I could widen my perspective and say, oh yeah, this is likely one of the great lessons of my life. This is a moment where I, was able to transcend into a new pattern, a new commitment to my
Hmm.
health. So I just want to like amplify that as a shift in my own consciousness because I definitely felt like, every time I got sick was a punishment. I
Hmm.
think for me pushing myself too far, or not wearing a hat, or not sleeping, or not
Yeah.
blah, blah, blah. Yeah.
Rather than just like an indication, because karana karya, which is one of the siddhanta or primary fundamental concepts and teachings of Ayurveda, is that we can always understand, in Ayurveda, karana karya, cause and effect. So,
Hmm.
person comes in with whatever list of conditions they have today, and Ayurveda, we understand nothing comes out of nothing. The philosophy, right? That nothing comes out of nothing. So we understand what through the timeline of pieces in a person's life that brought them to this place, from even being in utero
Hmm.
and even being preconceived, right? This is where the
Hmm.
astrology comes in, and also we can infer just by common sense in Ayurveda. It's a common sense, more like a yukti, which is like logic through deduction of like the facts and inference based on the information presented, that if a child was born with or had earaches, well, that already indicated there was a compromise in the tissue formation and the embryonic formation, contributed by the parents, contributed by the lessons that were coming in. So even when we go back to these early childhood neonatal kind of things, it came from something, you know.
Yeah.
Um, and Ayurveda understands that and understands like no one gets something without knowing where that something came from. And and because it's backwards and forwards in Ayurveda, so it's like it understands the history why the person has this condition or series of conditions, and it understands not only why you have it and where it came from, but where you're going with it. It can tell you any number of directions based on like qualities. Back to the original topic in this podcast, the gunas. What are the qualities? And we're looking for qualities in so many ways in Ayurveda that it's very subtle. And in Western medicine, it's not trained to be so subtle in that same way. Western medicine tends to rely on like labs to try to go, microscopically through lab analysis, through blood and tissue samples. Ayurveda goes more subtle than that.
Hmm.
In Ayurveda, we have the six-stage process of disease pathology, which is the samprapti. And, you know, by the time you get to stage three, there's something already on its way. If something is within stage one and two, they can be usually remediated with just daily practices, dinacharya, ritucharya, raticharya, ahar, vihar. But when it gets to stage three, now you're going to require more medicines. Stage four is already going to the next level. Stage five, it's already becoming profound. Stage six is like a really intense diagnosis. Western
Hmm.
medicine, Western labs, Western testing, Western usually picks things up around stage three.
Hmm.
Um,
Hmm.
and when it picks up something in the labs, it already means it's been there long enough to be picked up in the labs. And Ayurveda's like, no, this was already happening 2 years ago from the smallest little thing,
I mean,
that
I also think
doesn't get
about when,
assessed.
to your point, and I think this is so important with the recognition of being able to pay attention to the subtle energies and Western medicine. Again, I keep using myself because I think this is important to like make it real that Western medicine, and this is not a condemn Western medicine statement. Let me back up for a second. But I think that it's important to continue to name, for so many folks who have chronic illness, for so many folks, um, including myself, where none of what I've been experiencing has been picked up on on in blood work, right? Like not there,
Hmm.
and where my actual doctor, my Western medicine doctor, has said to me, we've reached the limits of
Hmm.
Western medicine. We've reached, this is the limit. This is as far as we can go. There is no
Hmm.
diagnosis here at this level. And then for you to be able to name the subtle qualities that are picked up, that you're able to pick up on in relationship with me, that you're able to pick up on when you hold my hand, my wrist to read my pulse, when you have, considered my sleep patterns in when I was 13 years old, right? I think that this is it's important to place emphasis on how the subtle can be ignored
Hmm.
and invalidated, which I think
Hmm.
also makes it challenging for folks. And this is a big reason why we call this podcast "Trust Your Gut," right? It
Hmm.
is in recognition of the ways in which we could override or I'm going to just say be gaslit, but override the subtle energies, the subtle information that we even have access to, right? If you're not an Ayurvedic doctor, if you're not skilled in this way, and so I think it's deeply important to like put emphasis on that.
Yeah. And with that, comes with the understanding a person's willing to take accountability and responsibility. And often people don't want to because they like what they're doing. They don't like not feeling good in some ways, but they like what they're doing and they don't usually make the connection or they don't care. And and that goes into Rogers and Thomas where they're obscured from seeing clarity and obscured from making proper choices. And because they're for Josic, they're fragmented in seeing the truth and what they should do. And they just, in this perpetual wheel spinning, 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 while the body's the casualty of this. It doesn't want to suffer. It's always going to adapt to its own intelligence, its own capacity as much as possible until it reaches the threshold where it can't anymore, and then pain is produced. And then that person gets to wrangle with, no, I don't care. I just want to do this and I just want to do that. This is an unconsciousness. And it might be making the conscious choice to do this, but if they were more aligned with that unconsciousness and working with the practices, then it would be more conscious and make more of a connection and go, I like doing these things, but maybe I should pace it out. Maybe I should do it differently. Maybe I should just get myself back in order first before. And people don't want to. I have a patient that has IBS symptoms that flare up. And he's a bartender and he also, works a regular full-time job during the daytime, and he also has, ADD, which doesn't help making the choices. And he's a really great person. He's helping a lot of people in the world from both sides of what he does with his career. And he loves this. But
Mhm.
nighttime shifts and, doing his shot drink, his shot after work, whatever that you can get
Mhm.
whatever drink you want after you're done your shift, and then it's like when he discusses symptoms, it's like it's automatically understood in my brain the cause and effect. It's like maybe get in order. Maybe you can't stop that nighttime work, but do you have to drink till you pass out?
Yeah.
Like, or that you get inebriated while you have these other symptoms, because those symptoms aren't just going to disappear.
Hmm.
It's not just like, well, whenever I have something spicy or I have some tomato sauce, my acidity kicks up with the IBS. No, it already was already inflamed because you had the
Yeah.
alcohol, you know? And it's like understanding the subtleties in these little pieces, they all contribute towards the bigger piece, always, for ill health and health. And so people sometimes just don't want to make those bigger choices, or people are
Yes.
caught up in these kind of things because then you live in a society where people are dealing with a lot of heavy crap every day. And you need that sweetness of connection, community, friendship. So you're like, I'm going to drink with my friends. I'm going to do this with my friends. I'm
Yes.
going to eat all these things with my friends because I'm in community with my friends. And that's pacifying the mental state that it's like a stressful world we're living in.
Yes.
I think in Ayurveda and yoga, we challenge that to think, when do we need to go deeper? And know like we could still hang out with our friends, but we don't have to drink. We don't have to do the cheese with the meats. We don't have to do all these kind of things. You could still just be present without having to indulge in these kind of things. I remember I had a patient that came to me, he was in his late 60s. His daughter was paying for him to see me because he couldn't afford it, but he had COPD. It was in like the final stages of COPD. And she's like, I
Mm.
want him to live a little bit longer so he can endure the holidays a little bit longer and enjoy his grandkids a little bit longer. So I did the consult with him. I can remember seeing his face. This is 2012. And I said, well, with the degree that he had COPD and he's in his late 60s, the prognosis is not good.
Hmm.
But I said, well, we can definitely work with this. We can create a little bit more space, a little bit more time. We'll do a little bit of herb supplement. And it was probably a few weeks before Thanksgiving. And I said, you know, the meal of Thanksgiving is contraindicated for COPD. And I said, you need to do, I think it was a soup I recommended. And he's like, what? I would be the only person having soup at the table with my grandkids and my kids. And
Mm.
he's like, I want to participate. And I said, do you think not having the turkey would make you feel like you're not participating in having a meal with your family when you're sitting there?
Hmm.
Like, do you actually have to have the same morsel going into your mouth to feel the connection? Or is it just being there, listening to everyone laugh? No one really cares what you put on your plate anyway. Because some people don't want the sweet potato on their plate. Some people don't want the cranberry. Does that mean they're not part of the dinner? And, I broke it down and he was like, oh. He's like, wow. And he did it. And after like adhering to the diet, going through the holidays, he lost a few pounds, he endured the
Hmm.
holidays. Um,
Hmm.
and then it was like, okay, like even just that little bit, like I read it was able to create a little bit of wedge in space and also like what the perception that needs to shift, you know. It's like I live this practice all the time. So when there are certain conditions that I have to contend with because I'm human and I have a body, and I'm like, yeah, I can't do this, I can't do this, I can't do this. And I might still hang out with my friends. No one thinks because they know I'm like doing this Ayurveda thing. And they also
Yes,
see how
yes.
great I am. And as I'm going through time and space and aging, how my aging process is slowed down, And so it's like, because this is a testament to the practice of the dinacharya, ritucharya, ratricharya, and the things that I do. Is it 100% perfect? It can't be 100% perfect because we're all in the world. But
That's right.
I definitely have tools. And so my patients that cultivate this practice have more tools so they can make better choices because that's part of my job is to give them tools in a toolbox to think, what would Dr. A say here? Or he told me about this and now I can make a choice that comes from a better place because I'm learning cause and effect myself.
That's right. I think it's really important, as you described, um, the tiny steps, because I think as a coach, a big part of my work with folks is around, what's the fractal? What is the tiny step that we can take and try?
Hmm.
And I think as you're speaking to, right, like our daily practices, our nightly practices, our seasonal practices, right? If we're breaking these down even more into smaller bites,
Hmm.
and considering that our lives might be organized around stuff that is counterindicated to our health.
Yeah.
That is hard.
So
Like that
yeah.
is really hard. Like to your point, I mean, I want to name as the person who shows up at Thanksgiving with soup.
Yeah, yeah.
Like
I get
I want
it.
to name as the person who is at the seafood restaurant who loves seafood, who is like, I'll have the chicken. And people are like,
Yeah.
you are?
Yeah, yeah.
Really?
I get it.
It's counterindicated right now. You can't have fish? What's
Yeah.
that? And
Yeah.
I want to name that our when I really sit with like, oh, what is my social life organized around? What's my community life organized around? And
Hmm.
how might those activities feel like they're counterindicated? How might I feel like I cannot be present,
Hmm.
right, in my body, present in relationship with folks if I don't have the stuff that looks like it is appropriate for this setting. If I'm at the bar and I'm having sparkling water, right? If
Hmm.
I'm at the, again, at the seafood house having the chicken, if I'm at Thanksgiving having the soup, what does this mean for me? What boundaries
Yep.
might I have to assert? And what supports might I need to assert these boundaries? That brings
Yep.
us to a place, I think, of really connecting with an invitation to really get curious about what is standing in the way of my choosing um, health in this moment, and what do I need to try something slightly different,
Hmm.
right?
Yeah.
And
Yep.
so, right, without throwing the baby out with the bathwater, without saying, like, I'm going to start an entirely new dinacharya practice, a new daily routine,
Yeah.
and set myself up for failure and
Yeah.
believe, right, that I cannot try again. What
Yeah.
I'm curious if we can leave folks with, yeah, I think with like a path to trying.
Yeah. A path to try, a path to starting, a path to at least just begin one step of the process. And then
Mhm.
also because of
Mhm.
how Ayurveda is organized, you know, um, you know, it's you're not alone in the process, right? You're not considered just
Mhm.
a number on a piece of paper. It's a
Mhm.
personal experience. But there is to some degree a certain kind of relationship that you cultivate with the doctor so that they can, you know, forecast for you and help steer you clear of things or get you out of things a little quicker. You're not alone in the
Mhm.
process. And it's like we start together. So like today with the snow path that I created for people to walk and come see me, my elderly patients are the ones that are a little bit compromised. I will meet them at their car and I will have them lean on me and walk back until they can walk back on their own.
Mhm.
Right. So the symbolism is like you can hang on to me a little bit and I will help you to become empowered, not codependent.
Mhm. Mhm. Mhm.
Empowered, because the ultimate is you
Mhm.
have to live with yourself every day and you have to make these choices. So either you hear my voice in your head or you are strengthened in your own voice in your head to make the choices to support this because the intention is your ultimate health. Because when you have your health, health is wealth. And then you can enjoy life to a fuller extent with more health that you have.
That's right.
Isn't that the goal? Isn't that the purpose? Doesn't matter how much money you're making and you're staying up working in that deal to 3 in the morning, but you're compromising your tissues and your adrenals and you're drying your system out and you cause any kind of like, stress, distress, anxiety, provocation, constipation. Like to what, you know, throwing ourselves under the bus, how much is it worth to us to do that? And so
That's right.
you have to just take a step and just start with the basics, which is start adjusting the lifestyle and the diet. And herbs will help along the way and treatments will help along the way, and you get to this rhythm, and then things will shift. But don't worry about where things will be 2 years from now. Think about what needs to happen today. And the first step is contacting me to set up a consultation.
Mhm.
And then sitting with
Yes.
me for 2 hours reviewing things, and then you get your little packet of recommendations, and then we start from there.
Yes. I want to emphasize the relationship. right? And as you speak to this interdependent relationship that I can speak to that we've had for gosh, oh my goodness, like almost 5 years. Yeah, yeah. A true relationship. And I also want to name how you have supported me in challenging and engaging my relationships and my community, my family, to be in partnership with me around my health. And I think that that includes, right, when I am, saying, okay, this is the time for me to shut it down. This is the time. This
Hmm.
is when I do this ritual. This is when we start. This is when I am starting the day. This is how I'm starting the day. This is when I'm taking my nap. This is when I'm doing yoga nidra. And being in the conversation with me to practice
Yeah.
how I am, right? Creating an intervention in my family around and in service of my health. So I just want to really highlight that the practices are relational.
Well,
And yeah,
highlight that because I'm excited at that point that I'm like, oh, highlight that, but hammer in also, the factual data, which is you came in with certain conditions. The list was a good list, and we've
yeah,
reduced it significantly over the couple of years. And every time we implemented something else or something else came up, we navigated you out of it. And we've taken you off many medications, right?
yes, we
And
have.
we've avoided other medications that were in the pipeline for you. So
That's right.
factually, you know, doing the investment in like the dinacharya, the Ritacharya, do this to this, you got COVID, do this to this to that. Like you came out and with less of the things that are going to be, with Western medicine and medicines and more of yourself,
That's right.
right?
That's right. That's right.
So that's the investment, that's the time, that's the consistency, and that's the dedication. And it's not a straight road. It's windy and it's
That's
ups
right.
and down. But again, it's like if you don't want to be on more medications, if you want to come off the medications you are on, or you want to reduce the dosage of the medications that you have to be on, or the frequency, or all these things, then this is how that works. And so you
Yes.
are the testament, you have the factual data supporting it. And, it's not just like, well, I'm doing this kind of specialty, but it's like, what is all this for? So that you can feel ultimately better. Because ideally, if you don't have to be on any medications, and Ayurveda is not going to replace, you're on 7, 8, 9, 10, 12 Western medicine, and now you're on 12 Ayurvedic medicines. No, it doesn't want to do that either. It's like you might be reduced to like 3 or 4 or 2 or 3 to be like maintenance kind of things, but it prevents the side effects and prevents more medications. I personally would rather that road, but I might be biased because I love Ayurveda.
I mean, I've become biased myself, so we have a disclaimer. Um, and I deeply appreciate that clarification. And yes, I am on the lowest number of medications that I have been on, I think, in maybe 20 years. So this includes allergy meds, and yeah,
Yeah,
yes,
even basic over-the-counter stuff. Because when you got COVID,
that's
I was like, don't do that, do this, boom, done. Like,
correct.
yeah,
Correct. That's right.
great. Well,
Yes.
I appreciate it. I love seeing this, and this is my passion. This is my dharma to do this, and it brings me great joy to these kind of things. So, anybody
Ashe.
that wants to come see me, you can find me at Still Point Ayurveda in
Mhm.
Philadelphia, and I do telehealth sessions, so it doesn't matter where in the world I can find you.
Yes, and he will find you because you're in a relationship. And so I want to thank you, Dr. A, for today, for our conversation on how we maintain our schedules and orient them towards health. I will see you next month. And please definitely check out Dr. A, check out his newsletter, his monthly newsletter that comes out with all kinds of goodies, recipes, and guidance.
Upcoming cooking class for next month.
Hey, oh,
Great.
I hope I can eat the food. Okay. Um, so we'll
Well,
see
thank you
you
so
then.
much.
Okay.